Globally, 1 in 4 of us are likely to suffer with a diagnosable mental health problem at some point during our lives. So it's no surprise that British Muslims are also dealing with mental health problems and issues. Mental health problems are one of the main causes of overall disease burden worldwide. Common mental health disorders are primary drivers of disability worldwide, causing over 40 million years of disability in 20 to 29-year-olds. Severe depression is the second leading cause of disability worldwide and a major contributor to burden of suicide and heart disease. 1 in 6 people in the last week have experienced a common mental health problem. A common mental health problem could be anxiety, depression, or substance misuse, for example. So someone in your family or friend circle is or has been suffering with a mental health difficulty. The key question we have to ask ourselves is, do we talk about mental health enough? The answer is no. Unfortunately, mental illnesses are still hugely stigmatized, and there is a widespread lack of understanding and awareness of what is a mental health problem and how it can be dealt with. Often amongst the Muslim communities, this is even worse. And there are some myths. A common myth, for example, is that if you're depressed, it's a sign that you have a lack of faith in Allah or a lack of Iman. However, mental health illnesses are like any other illness, and they can affect anybody. If someone is suffering with a mental illness, it's not through any fault of their own. Despite being so prevalent worldwide and being so common, mental illnesses remain underdiagnosed. Less than half of the people who visit their GP, who meet the criteria for a diagnosis of mental illness, less than half of them are identified as having a mental health problem. On top of this, patients are also reluctant to seek help. Only 2 in 5 of us who are dealing with a mental health problem seek help in the first year of experiencing symptoms. This underdiagnosis and reluctance to seek help are even worse amongst British Muslim communities. Having worked with grassroots communities for a number of years, my feeling is that there are already high numbers of Muslims that are experiencing mental health problems. However, they remain unrecognized and undetected by mainstream organizations and services. This means that many Muslims are dealing with mental health problems, but they're dealing with it alone, in silence, and are isolated. And they're not getting the appropriate help and support they need to help them deal with their mental health problems and get onto the road to recovery. Right now, many of us are fasting, and if you're like me, in this time before iftar, you're feeling very tired. Also, listening to me is probably very hard work right now, and concentrating what I'm saying probably feels like you're wading through thick mud with a sort of thick fog descending on you as well. I'd like you to take a moment and reflect on those feelings of sluggishness and tiredness. Now imagine you experience those feelings every day, all day, for a long period of time. You would get to a point where you couldn't function, where it would just simply be too exhausting to go through the motions of everyday life. Getting up in the morning, sleeping, eating, they all become a struggle. Well, this is what it would be like if you were suffering from severe depression. For Sophie, not her real name, being severely depressed was part and parcel of her life as a 22-year-old with bipolar disorder. Bipolar for her meant that her depression was punctuated with mood swings, where sometimes she would go through periods of feeling very low or very high and overactive. Sophie's family couldn't accept that she had a mental illness. They said that people like us do not suffer from mental illnesses, and they didn't allow her to get treatment for it. They felt that if people found out in the community that she had a mental illness, nobody would want to marry her. This lack of awareness and this stigma associated with mental illnesses, it stops people from getting help. Just imagine for a second that we stop people who had diabetes from getting help. It would be devastating for them. And in the same way, it's devastating for people with mental illnesses. If somebody has depression and it's not treated, it could lead to long periods of hospitalization, and it could also, in worst case scenarios, cost people their lives. So if you know someone who is dealing with a mental health problem or challenge, take the time to speak to them, show them some compassion, and encourage them to get help. There is no shame in suffering from a mental illness, and there's no shame in getting help for it or being treated for it. Thank you.